welcome to the Healthcare Report. I'm Sonia Pelagia, a high school student with a passion for exploring the ever-changing world of healthcare. In every episode, we dive into the latest breakthroughs, career opportunities, and stories shaping the future of medicine and technology. Whether you're a student, a professional, or just curious about the healthcare industry, this is your go-to space for fresh insights and meaningful conversations. So let's get started and discover what's shaping the future of healthcare one episode at a time. Today we have with us Dr. Saket Shah, an experienced family physician and Chief of Professional Affairs at Stanford Healthcare. Hi, Dr. Shah. Thank you so much for joining us today. How are you doing?
Hi, Sonia. Thanks for having me. I'm good.
All right, so let's start at the beginning. Could you maybe share a bit about how you started your journey into becoming a doctor?
Yeah, absolutely. My journey actually started when I was in grade school, and I grew up learning medicine and just seeing my father, who's also a general physician, uh, at the peak of his career, and just his interactions with his patients and gratification of how he went through his day to day with being a physician, and that's really got me interested in medicine. It's a bit of a cliche in that way, but I think that has really um, that's really where my grassroots for love for medicine really lied. And as I went through high school, growing up in India, there were there were opportunities, but I at that time after high school, my parents felt that I had better opportunity for medicine, pursuing a career in medicine, especially here in US. And so I moved here after finishing high school in India, and I started out in college at a community college and just slowly worked my way up into graduation and then pursuing actually master's in public health before I went into medicine.
Oh, wow, that's really interesting. And so I did a bit of Googling about your profile and discovered that you are a DO. Could you maybe
Yeah.
explain what that is?
Absolutely. So I was in Chicago, uh, where I lived when I moved here from India, and I moved here, as I mentioned, after high school. I have an uncle and aunt who live there, and so I stayed with them, and that's when I really discovered what DO is, which is Doctor of Osteopathic Medicine. There's two major philosophies of medicine and how medicine is taught in med schools in America. And there's the traditional allopathic schools, and graduates of those are MDs that most people know. And then there's osteopathic medical schools, and the graduates of those are Doctor of Osteopathic Medicine or DOs. The basic medicine and learning of basic sciences through anatomy, physiology, and the practical medicine is all same. However, the DOs also get special training in musculoskeletal medicine and hands-on manipulation uh, techniques, which is very unique to what we do. And so we do traditional medicine, but we also do manipulation techniques for various type of musculoskeletal problems in specific conditions in light of knowing person's medical history. And so I was introduced to this philosophy while I was in college, and that's what got me interested in this philosophy. And I think there's also a deep-rooted belief in osteopathic medicine that our body, mind, and spirit are in one, and that they work together. And if you are having some kind of mental issue, often that can manifest in physical issue. And so in general, the DOs have a tendency to view a person as one, in that I think that there's a if there's a problem that lies in an obvious somatic way of your back or your head, there may be related to other things going on in that person's life. And so we have a more of a holistic approach to approaching a patient, uh, in my view, and what I've learned as a DO.
That's really interesting, yeah. Touching back on like dealing with patients and like your daily activities, could you maybe tell me more about like your day to day, like the patients you treat and like, kind of like your schedule?
Yeah, absolutely. So I am a trained family physician. I was trained in the full scope of medicine. And as when I graduated from Midwest, I decided to come to California for a variety of reasons. But out here in the Bay Area, especially, I discovered that most family physicians did not practice a full scope of medicine, and most graduates did not want to continue doing obstetrics, which is part of our training. And so, in doing that, I gave that up, and then the practice that I started with also was more catered towards adult medicine. And so, my current practice has evolved in seeing basically kids starting at about 15, 16, adolescent age. And I see patients all the way up until geriatrics age. And my day-to-day practice is generally a mix of adults with a variety of different things. So somewhat of healthy adults that come in for their routine physicals or just a one-off complaint of some sort. And then there are older adults who may have a number of different medical problems and conditions that we help manage alongside with some of the specialists that they may be seeing. And as a DO, I also have patients who come in to see me for specifically for manipulation. So one advantage that I feel that I have as an osteopath is that in primary care, I'm still able to continue practicing the hands-on manipulation, which I'm very grateful for.
Oh, that's really interesting. Okay.
Yeah,
And just as like a side note, was there any kind of pivotal moment or some sort of experience that like shaped you to want to become a DO?
I think that the mind, body, and spirit philosophy and a holistic approach really something that I connected with. And I felt that that had a deeper meaning and deeper connection for me. Just learning and knowing a little bit of Eastern medicine growing up in India. And so I felt that that would have a better connection for me in terms of becoming a physician and practicing that in my day-to-day practice. So I think as I learn more about osteopathic medicine, I think that really jived with me, and therefore I ended up going into osteopathic medicine.
I know the journey to becoming a doctor is a very difficult and strenuous process. So what was your experience with like the MCAT or any other entrance exams that you had to take?
Yeah, it's interesting. I think those were some of probably more challenging days for me, as I remember those days. Most, traditional students are going through their 4-year college and dealing with courses and exams and midterms and all the things that you may already know, alongside with preparing to go into a graduate school. And so it is often a time struggle, but also um, a skill set that I felt that I never had growing up. MCAT, like most other entrance tests, or most other entrance tests, MCAT is a multiple choice type test, and um, it is not been my strong suit. And so preparing for that kind of test was a challenge in itself, but also just studying the amount of things that were being tested. Um, Most of the things were not actually medicine related, but had a variety of different domains that they would test on MCAT. and it's a real time crunch when it came to multiple choice. And so preparing and strategically learning how to do well in those exams was something I had to learn. So probably not my fun memories on this journey, but it was something that I had to overcome, and I did.
Yeah. I feel like those kinds of exams can really kind of stress people out to a point where maybe they want to choose a different career path or something. So it's really inspiring that you chose to like continue with the process and overcome it.
Well,
Um,
interestingly enough, that thought did come to my mind to think that, well, if I can't get through this, maybe that's the end of my journey and I need to do something else. For whatever reason, I stuck with it, and I went through successfully with taking the MCAT, and my score was good enough that I was able to get into medical school and finally go through that journey.
yeah. Where did you go to for your undergrad and like grad and medical and all
My undergraduate was in one of the colleges in Chicago. There's a private university called Benedictine University. That's in the suburb of Chicago. So that's where my undergraduate was. And that's where I also did my master's in public health. And prior to that, I was at a community college, also in a suburb, for first year and a half to 2 years of my college journey, right after moving here from India. My medical college was in Missouri. I went to an osteopathic college. Back then it was called Kirksville College of Osteopathic Medicine, or KCOM. That's the first osteopathic school in the nation. So it's the original osteopathic medical college. It is now renamed to A.T. Still University, um, something or the other. A.T. Still is the founder of osteopathic philosophy, and so um, his philosophy resonated throughout the teachings in the institution. Um, but that's what it's been renamed now to.
that? That's really impressive. Um, and then now I kind of want to move into another segment. So this segment is going to be based about work life and like roles as a family physician. So could
Yeah,
you maybe tell me about your responsibilities as the chief of professional affairs at Stanford Medical?
sure. So I've always been in some kind of semi-leadership role, if you will, since I joined my practice. And I've been at the same, I've had the same employer. I've joined Stanford after graduation when I moved from Chicago to California and back in 2012. Um, and then my role evolved into becoming this professional affairs chief in 2021. And my role in that involves different variety of different responsibilities. Primarily, they revolve around managing employment matters, HR matters, legal matters for our medical group that I'm part of. And we're a multi-specialty medical group consisting of about 300 physicians and nurse practitioners and PAs. So it's a large medical group. It's a good sized medical group. Um, and then I also have some involvement with our senior leadership team in a variety of other aspects of the medical group that might include um, onboarding process, strategic, evolution of the group, communication, amongst other things.
Oh, wow, that seems like a lot of fun days at work, I'd say.
There are
And
fun days and there are tough days, but
yeah.
it's like any other job.
And do you see this job as something you'd like love to continue doing, or would you see yourself in any other positions?
I definitely love to see an evolution in this role. And I have seen a bit of an evolution since I've joined, and it's taking on more responsibilities in different domains within this role. Um, but I definitely see myself growing in this role and not moving away from it in future.
And then what do you think is kind of the more like challenging parts of your job? It can be either like dealing with patients or like in like the more administrative parts of your job.
Yeah, I think that, seeing patients has always been fun for me. And I think that as I've had a few years being there as a physician, I feel that I have much better understanding of human-human interaction, but also just physician-patient interaction and physician-patient relationship. So I think that that's really been a refreshing part of my day. And some days I have to wear both hats, being a physician and also doing a bit of administrative work. I think that a welcoming challenge part of my administrative role is really having difficult conversation. And it is something that I've had to continue to practice and teach myself, and I still continue to learn something new every day in that role. Um, but as I mentioned, there are sometimes HR matters, employment matters, legal matters that, as you may imagine, having those kind of conversations with another physician or a nurse practitioner or a physician assistant is not necessarily easy, but also it's not something that just comes to people naturally. And while I still have to be respectful for who the other person is, I still have to be firm in some way to get the message across and to be as neutral as possible. And so these are often difficult conversations, and how to deliver them, be empathetic, and do that well with making sure the message is clear, is something that I continue to learn.
And then kind of bouncing off of that, dealing with like patient-patient interactions or doctor-patient interactions.
Mhm.
This is kind of off topic, but do you see technology impacting like how AI and telemedicine are evolving in the healthcare industry? Do you think these things could potentially like improve or like make it worse for the industry?
Yeah, I think that's a great question. I don't only think I actually already see how that interaction is because um, for better part of about a year, I have been using an AI tool at work when I see patients. And it's an ambient listening tool like many other tools that are out there available, including even on Zoom platform, there's ambient listening. So it really has evolved in terms of the quality of the material that it puts out, but also a tool that has helped me focus more on the patient while I'm with the patient rather than more on looking at my screen or looking at a chart, because I know that the AI tool is helping me capture the conversation at the end of the day, that I'm not sitting there trying to remember and type everything that I need to put into the patient's medical record. So I think that this is just maybe step one or step two of how AI is evolving in healthcare. And I do see a huge part that AI will play in medicine. I think that AI in medicine is is here to stay. I think that physicians and clinicians who use AI will eventually replace those who will not use AI. And so I don't see that AI will replace physicians or clinicians or people that take care of patients, but I think that they will truly enhance and elevate what we do for patients.
Sure, yeah. And I also learned from the previous episode of my podcast that AI can definitely play a part in like scanning, like X-rays, radiology, as well as
Mhm.
like administrative tasks where where less people are needed to work so that there's more of a focus on the actual like diagnosis and patient care.
I think that's true in specifically in radiology, where AI can really enhance, as you teach AI, it can really enhance uh, the output. It can really enhance some of the administrative mundane tasks that you mentioned. I do think that because we're in such area that requires precision and we deal with people's lives, that until AI until AI gets to that level, you always will need a manual oversight. You need a personal touch. You need physician. You need other allied healthcare workers to be doing some part of what they're doing, but perhaps making their job, AI is making their job easier. Again, not necessarily replacing it.
And then do you see people kind of gaining an over-reliance on AI at all? Or do you think that people would know like their boundaries and to like not overuse it to replace their own job?
Yeah, because I think AI has become so prevalent in other parts of our lives in some way or the other. And I think people are choosing how they use AI and where they use AI. And it's on our phones and it's in our everyday life, whether it's emails or other communication matters, that we in medicine have to remember that we just can't take things for granted. And there are do's and don'ts, there are boundaries, and there are limitations of what AI can and cannot do, that I think we have to constantly remind and we have to continue to remind people, and we have to grow with that to make sure that it's used in the right capacity.
Yeah, for sure. And I was wondering if we could maybe take a jump into telemedicine, which is kind of related, but how do you see like telemedicine, if not like it's not like full doctor to patient interactions like in person, but do you think it's beneficial to the healthcare industry or do you think it's kind of like lessened work?
I think telemedicine has huge part to play in healthcare. Um, I think not just here in the US, but worldwide. There were some early there were some early pioneers that try to use telehealth before COVID in some very minuscule capacity. And then since COVID pandemic, I think telehealth has really shot up. There are some recent scares or considerations that we had looked at where CMS is rethinking use of telehealth and where it would reimburse physicians for using telehealth. But there's no vote from the government to discontinue that service. I think that it would be a real shame if it were discontinued or the benefits were lessened for patients and for physicians. There are there are huge benefits and really timely um, patient access when there's telehealth. And it sure has limitations in that there are boundaries that we need to respect and limitations that we need to respect of what telehealth can and cannot do. However, when if it's used in the right way, it really can enhance access for patients to their physicians, to their care teams. And this is especially true in for the folks who live in rural areas where they're not easily access, they don't have true brick and mortar offices and hospitals easily accessible. And they may be miles and miles away that, can really limit their access to healthcare. And so telehealth has had huge benefits there. And in mental health space as well, I think telehealth has provided huge benefits that making mental health that's already difficult to access in general, telehealth has made that somewhat more reachable for an individual.
Now we're just going to move on to like the final segment of the podcast. So the segment is about like information for future generations.
Mhm.
So we'd love to hear like any advice that you have for the future generations of like high schoolers or undergraduates that are seeking to um, grow in this career. So what is one piece of advice that you would give to these people?
I think being in medicine and serving in some capacity, being a healthcare worker has still a huge, it's still a huge, humbling experience for those who are interested in medicine or in some capacity of being in medicine. Having some early exposure to what their interests are and being able to see what people in those areas do, I think can be a huge benefit to those who may be interested in that, especially for someone in high school or in college who may just have some ideas of what the field is about or what their future job may be like, to be able to see day-to-day dealings of what a physician or a nurse or a dentist or a pharmacist goes through can be really an eye-opening. And as you learn more and more about yourself, you know, getting through high school, getting into college, and going through the college years, you would know, you would have a much better idea of where you fit in and what your day to day may look like. And you may see some challenges and you may see some opportunities. And so I think that this is an exciting field. I think that um, young individuals who are really interested in going into medicine should, by all means, grab those opportunities and get as much hands-on as possible and be able to see what they're getting into early on so that they can make the best decision for their career and future.
That's really inspiring. Thank you. And as someone who also wants to go into medicine, I want to become a dentist. So that's quite inspiring. Yeah. And I think I agree as well. Like picturing yourself, how you would be working your day to day, seeing like if that's something that really you would fit in with is really important to like deciding if that's really something you want to stick with. Because like we obviously would change our minds somewhat in the future if things become difficult or too rigorous. It can be
Mhm.
like it can change your mind, but I think having that like focus of how you see your life being in the future can definitely help like keep you grounded and keep you working towards it.
Absolutely. Absolutely. I think AI technology and just where healthcare is moving, especially in America, I think it's very exciting to see because I think the future holds a lot for us in how we serve patients. And so I think that future is still bright and exciting for the young generations like yours who's wanting to get into it now.
Thank you so much for sharing your valuable insights today. It was so nice talking to you, and it was really inspiring. And it was really interesting to hear about your experience and your journey. And then, do you have any final thoughts that you would like to leave with us today?
My final thoughts, I think, is something that I've alluded to earlier. I feel really blessed to do what I do every day. Um, and I think being a physician is really a humbling job. And healthcare has, as it's going through its, I think, evolution, will reach its peak in probably next decade. And I think the future of healthcare is bright and we have some really capable minds to make sure that we lead it in the right direction.
Thank you so much for joining us today. And then thank you for everyone tuning in. Be sure to join us next time on the Healthcare Report for more inspiring conversations and insight to the world of healthcare.